And welcome back to the Jewish Review. We're downtown Toronto, Bay and Dundas, in the heart of the city. And we have leaders in all the various industries in business, arts, commerce, everything. And we have a young periodontist.
That's correct.
Am I saying it right?
Yes.
Yeah, it's a little bit of a tongue twizzler sometimes there. It's nice to meet you. Nice to meet you. And so it's Ryan, right?
Ryan, yes.
Ryan. And your last name, because I couldn't get the pronunciation.
Sure.
Huh?
Like, are you sure?
No, that's what was messing me up. I thought you were joking. They play in a practical joke. It's really...
It is, and you know what?
So what do people always say to you when... Like,
I've gotten a lot of variations of it.
But what's the really stupid joke that you always got, or when you were a kid you always got?
Well, you know, like you'll go and check in for a reservation at a spa or something and be like, last name please? And I'll say, sure. And they'll be like, so what is it?
Listen, and I feel you've recovered pretty good from the childhood.
You know what? You can call me whatever you want.
But I'm saying that you seem to have recovered pretty good, because there were some rough patches, right?
Yeah.
People would have a little too much fun with the name. What did you ever get into? Like, I know we're off track here, but did you ever have to plow somebody?
Thankfully not.
Okay.
But it probably wouldn't have worked out too well for me.
Because with my temperament, Ryan, if somebody, because I have Wall, it's my last name.
Right.
And I got a few kind of lame jokes, and that's where I had to step in, just...
Yeah.
You know, because I look like I'm reserved, right? Maybe like a lawyer, accountant, right? Maybe periodontist, but I'm really actually I was a boxer when I was younger.
Could have fooled
at the Brooklyn Yeshiva.
Yeah.
Pow, pow. Simon, sometimes you got to just lay somebody out. Am I right? Okay, so let's get back to periodontistry.
Sure.
Dentistry.
Yes.
So, what attracted you to dentistry, first of all? Because was it the typical Jewish parents trying to say, well, it's law school, it's medical school?
Well, it wasn't that. I mean, there's no dentist in my family or anything like that, but I was always into the sciences growing up and looked into the different options, and I think it was a combination of many things that attracted me to dentistry. The healthcare aspect of it, the long-term relationships you could develop with patients over time, and the lifestyle, not having to work in a hospital or a setting like that. And ultimately, that's what drove me to
You're a germaphobe. I could see it as soon as I looked in your eye. You're a germaphobe, right?
I don't like the hours there, you know?
You don't like the hours. Or the germs.
Or the germs.
But this is something you have to get over quickly, right? When you're studying to be a doctor of any kind.
Right.
Did you have any issue with that in the beginning? Like, just in the very beginning, like with some of the aspects of the job that are a little bit unsavory sometimes?
Well, while I was in dental school, I actually watched my first surgery, and I'd never seen any type of surgery before, and I actually fainted.
You fainted?
And like, this guy has no hope, right?
Yeah.
But I made it through, and now that's what I do every day.
Ryan, you give me so much inspiration.
Yeah, you can do it.
You give me so much inspiration. Yeah. So you fainted.
Yes.
Okay, now, I just want to say to you, from a PR standpoint, I'm not sure that you want to be saying this to prospective patients. Okay? The fainting doesn't happen anymore. I just want you to know.
Through that,
We've gotten through it. He might have a mild foggy patch, but he's got assistance to cover in that regard, so don't worry about it. I just wanted to make sure we do some damage control.
Thanks for clearing that up.
Yeah, damage control, it's got to be done. Yeah, because you got over it. And that's inspirational for people that are going to be for people studying to become a periodontist.
Right.
See, we're not only educating, we're inspiring.
Great.
I think it's cool. So you got into this, and how do you jump from dentistry then over to periodontics?
So while I was in dental school, we were exposed to a lot of different aspects of dentistry. It's a really, really broad field, and I decided that I wanted to become more of an expert in one specific field. So after dental school, I did a 3-year residency to become a periodontist. And, and what a periodontist is, it's, if you look at the word, the tongue twister, and break it down a little bit, so peri means around, odonto is the Latin for tooth, and ologist is a specialist. So basically, I'm studying everything that's around the tooth. So things like the gum and the bone and all the other tissues in the mouth besides the tooth itself.
And so how do you decide where you're going to go? Because it's really all, from what I understand, it's all about going to the right practice, right? Because you're as good as the team around you. I think it's kind of that way. Would you agree?
Yeah, I would. I mean, there's lots of general dentists who deal with gum problems like we do, but there's certain cases that are a little bit more advanced or severe and may require the attention of of a specialist. And in those cases, we'll work together with a general dentist to ensure the best possible treatment for the patient.
So the age-old question, what is the cause of gum disease? Because I hear a lot of people saying sometimes genetics, big part. Sometimes people say there's other contributing factors in terms of oral hygiene. Some people say it's a mixture of both. Some people say it's got nothing to do with either one.
Right. So it's a very multifactorial condition. There's lots of different things that we know cause it. And like you said, genetics is definitely one. The biggest cause is probably plaque or gunk that sits on the teeth that isn't cleaned off. Other factors can contribute to, like certain systemic medical conditions that are not well controlled can contribute to gum disease as well. So there's really a lot of things that can play a role. There's other things that may contribute that we're not as clear on right now, and there's lots of research going into that. But those are sort of the big things that we know for sure can contribute.
Now, I have to ask you it's an honest question from me, and it's a question that I don't want to put you in an awkward position. But I noticed that my dentist, they were starting to, and you know, marketing is part of any practice, but they were starting to call me and try to get me in for my cleaning, you know, more than twice a year. And I was thinking, what really is the appropriate amount? Because it's like anything else, it can't be overdone, right? And it can't be underdone. Is that correct?
Well, it could be overdone and it could be underdone. And really the amount of cleaning or scaling, as we call it, that a person needs should be determined based on their individual needs. So based on how their oral hygiene is at home, how well do they keep things clean.
Right, but what I'm saying to you is that a practice could get somebody in as often as they like. It really is only a phone call. Right.
Hopefully they're only doing it as much as someone needs.
Right. So this is what I'm saying. Integrity becomes a big thing.
Yeah.
Correct?
Yeah. There's a lot of trust between the dentist and the patient because we're working in your mouth and you can't really see what we're doing. You got to take our word for it.
So then how do you build your trust between you and your clients, between you and your patients? Like, how do you go about doing that? Because everyone has a different style, right?
Yeah, for me, it's really about sitting down and trying to just talk to them for quite a while, get to know about their history, their family history, what they do for work, asking about different things like that to try to develop a rapport and before we even start talking about the things that are going on in their mouth, because all of those other things will actually play an important role in developing their treatment plan.
Right. So I'm thinking, if you're Jewish and you have a pretty strong Jewish client base and you're making an effort to sit down with them and get to know them on a personal level before you get into anything to do with dentistry, right? I'm thinking there's a chance this could be like a runaway train. This could go right off the tracks because, you know, if I'm sitting with you and we're trying to get to know each other, you know, I'm going to start like whining and complaining about everything. My shingles and my goiter and my, you know, I mean, already too much information. You didn't want to know about my goiter.
That is important things because these patients with different conditions like that can be on a wide array of medications.
Right, irritable stomach and, you know, it's just, it goes on and on and on. My propensity for like, you know, water being trapped in my right eardrum. We've already, you know, I could go on and on.
Right, and we need to know about the medications because they may interact with something that we're going to give them.
But what I'm saying is it's a little bit cumbersome sometimes for you. Like, do you feel like sometimes you're a bartender, you're a psychiatrist?
A little bit of both.
Yeah. But you do, I guess, all kidding aside, it's about, you know, getting the information that you need to understand the person. Right, and then moving on into your professional business. Is that correct?
Exactly.
Okay, so let's talk a little bit about implants because implants are a big buzzword right now. I mean, lots of people are getting implants done. And how do you decide when implants are appropriate and when they're not?
So a dental implant is probably the best thing that we have right now to replace a missing tooth or missing teeth. And they're basically titanium screws that will go into the jawbone and integrate, grow together with the bone. And once they've grown together with the bone, they shouldn't move for a very, very long time. And they're very good at doing that. Not 100%, nothing in dentistry is 100%, but they work really, really well.
What percentage do you give percentages?
Well, it sort of depends which area of the mouth you're working in, because there's different qualities of bone in different areas of the mouth, and it also depends on the patient. For example, a patient who is smoking a lot, the implant will have a lower success rate than someone who is not smoking and healthy.
So like anything else, it's a question of bone density.
Bone density and other systemic factors.
Right. Right, because I want to tell you something. It's got nothing to do with dentistry. My mom needs a hip replacement. Michelle, I was telling you about this too. Oh, sorry, she needs a hip and a knee replacement.
Right.
They said her bones were too soft, and she's devastated now. And so, do you ever run into situations like that where you say, "Hey, sorry, you just physiologically, anatomically, you're just not strong enough to have this done," and then of course you have the disappointment of the patient?
Yeah, not every person is a candidate for them, and if you were to put implants into a patient who isn't a good candidate, it can cause a lot more problems than if you just hadn't done it in the first place. So patient selection and making sure they're well educated as to what's involved with the process is important.
And it's your research that becomes very important.
Exactly.
Very important.
Exactly.
Yeah, so, and because the safety of the patient is first, correct?
Right, that's our primary goal. We want the patients to always be happy and comfortable and have a solution they can live with and eat with and smile with and be confident
What's
with.
the best pain drug that they have in dentistry now? Do you still have laughing gas? Sorry, I'm not up to date on that.
Yeah, no, laughing gas or nitrous oxide is a good thing that we have available for us, and it sort of can help to take the edge off a little bit.
Ryan, could I hypothetically take some laughing gas before I do a show?
Well, what happens as soon as you take the mask off, the effects of it wear off really quickly. So you'd have to get
like
right
I'd have 30 seconds?
Yeah, you probably
60
could have
seconds?
30 seconds.
Like would I just come on, just be like, it would just like that?
That's basically how it would work.
It would just fall right off.
Yeah.
Oh man, I got to look into it. So is there other drugs I could use
So
to make the shows better? Because quite frankly, they've been sucking in the last few days, I think because of the weather.
Yeah, well, we have a lot of other drugs that may help you.
Yeah.
There's lots of other ways of sedating people.
Sounded like that was a setup for a Prozac joke.
Yeah, some people are very anxious, and sometimes anxiety can manifest as hyperness.
Now, do you see me as potentially an anxious person? You can be frank with me.
You know, usually it's the people that you least expect, so it's quite possible.
The people that you least expect. Now, you may have a career in politics, my friend. You may have a career. So as we segue into a close here, again, I always say the consumer, patients, clients, they have a pretty broad spectrum of choices, of options out there today. There's a lot of people in periodontics, right? Or did you say periodontistry?
Or periodontology.
Peridontology.
You make it longer.
A lot of, we just try to make it longer. Dentistry is really competitive nowadays. I mean, you almost see a dental office on every corner. Why is that, by the way? There's been a proliferation. Have you noticed?
Yep, there are more dentists right now than there used to be, and that's for a couple reasons. So the older guys are working longer, and they have increased the class sizes at the dental schools as well in the area.
Right, and nothing to do with insurance? Somebody said there was possibly some insurance benefits that play a factor. I'm not sure if
Not to the increased number of dentists right now.
Okay, because there has been a proliferation in, I noticed in Toronto and other parts of Canada. Is this going on in the States too, do you know?
Yeah, there's a lot of people from Canada are going to the States for school, for example, and then coming back to work in Toronto.
Right. So let me ask you a personal question. What would you be doing if you weren't in dentistry? Like what?
I don't know, maybe stand-up comedy.
So we can do a little switch.
Yeah.
We could do a little switch job sometimes.
Yeah, I wish I could do what you did. So.
You know, would you trust these? Would you trust these hands? I mean, they're, you know. Did they in school? Did they analyze like how? I was joking with one of your partners, and I said like, you know, you're a great carpenter, because there is an aspect of carpentry, for lack of a better word, or you know,
it's like an artistry too.
So what I'm saying is that could they screen out in school who might not be like? How do they know who's got good hands? Well, I mean, I know it sounds funny, but I mean, you want somebody who's got crafty hands, correct?
Right. Well, in Canada, part of the admissions process, there is a test of manual dexterity. They make you carve you have to carve a piece of soap into a specific shape with dimension. But also, if you don't have good hands, you're not going to make it through dental school. So that's reassuring.
Wait a minute, I'm very curious about this soap test. So they make you carve a piece of ivory soap or something? Is it Dove or ivory?
Like a cylinder of soap.
It's a cylinder of soap.
I don't know the brand name.
Yeah. Okay, because I'm thinking that would be good to do like a little cross promotion with ivory or Dove or something like that. You know, get maybe some kickbacks or something. Do you have the name of the dental school? Maybe I'll pitch.
We can get that to you.
Yeah, I think that could be an interesting idea. So what did you have to carve?
are just like different geometric shapes of different dimensions.
Right, right.
Yeah.
So they know right there how good you are with your hands.
I don't think it's a test with a lot of validity to it. I think it's a little more antiquated, but they still have it as part of the admissions test.
Right, right. Now, incidentally, one of my girlfriends gave me the soap test before our third date. And I was wondering, what the hell is she doing?
Yeah.
What the hell is she doing? The soap test. That's ridiculous. Listen, it was so much fun to meet you. This is, I think, is it your first time on TV? Or you've done some other interviews too?
No, I think this is my first
So
one.
how did you had fun? You had fun? I hope so.
You make the process very, very easy.
I hope so. I hope so. And I wanted to say that, just before we close here, I've interviewed a few of your partners. I've been on this show as well, And there is an amazing integrity and sincerity and understanding of the patient that really, I think, is the cornerstone of your practice. Would you agree? I mean, it's not just the talent, right? It's actually caring about the patient. And I notice a lot of practices fall short in that department. You guys seem to really care and have all the long-term relationships to prove that.
Yeah.
So is that something that you were looking for, I guess, in a practice? I would imagine you were.
Yeah, the practice I work with is sort of a unique practice, and there's a lot of great specialists there. So it's only specialists who work in our office. There's prosthodontists, there's periodontists, and endodontists. So basically we deal with a lot of complex cases there, and we work together.
Prosthodontists, periodontists, endodontists.
Yeah.
Do we have any more dentists?
There's other ones, but they're just not in our office.
Yeah, but I mean, any other dentists? Like what kind of, perio?
Endo,
There's another
prosto.
Yeah, endo, prosto, perio. Do we have a fourth?
Not in the office.
Not in the office?
No.
But they're out there somewhere.
There's other specialties.
Maybe in Missouri.
Right.
But they're out there somewhere.
Yeah.
Okay,
Yeah.
that's great.
Yeah.
And then the assistants? There's
Assistants are excellent.
No, I mean, there's dental hygienists, there's dental
There's
assistants.
assistants, there's hygienists, and there's
I just want to get a scope of the office.
administrative staff as well.
Administrative staff as well?
Yeah.
Okay, and
a lab staff as well.
you actually have lab in the office?
Yeah, our office has its own lab facility,
Okay.
which allows us to do a lot of great work for patients there.
Okay, now you have a kitchen there as well, like a little small kitchen?
Yes.
Smart fridge?
I don't
Smart
think
fridge?
it's smart, but it works.
Smart toaster? No, this is all the rage now. Smart fridges and smart
Yeah.
toasters. You don't even have to do anything.
I can't turn on the toaster from my iPhone or anything.
Yeah.
like that.
This is all the rage. And do you
One
have
day.
good housekeeping?
The facility is very well kept.
Because housekeeping is like the unsung hero of
Yeah.
dentistry.
Yeah.
Right? You would be surprised how many offices I went into and there's like Burger King wrappers on the floor.
bugs flying around
Yeah,
you.
and you have these like little dust mites and bugs flying around. You're only as strong as the weakest link. Oops. You're only as strong as the weakest link, as they say. Well, Ryan, it was a pleasure to have you in the studio. I wish you continued success in all of your endeavors. And you're a sharp young, periodontist, and I think you have such a promising career. And I hope it goes famously for you.
Thanks so much, Eden.
Thank you. Okay, there you go. Another great periodontist that is doing great work in his industry. We're on the Jewish Review. We're going to be back right after this. Thanks for being here, everybody. Nice to see you. Thanks, Ryan. That was fun.
Thanks.